Hello, I'm Jim Morey, Chairman of the Board of the Community Health Network. For all of us in healthcare, this year has been very challenging. In these difficult times, your network board appreciates and salutes your unwavering commitment to improve healthcare and the health of the citizens we serve. Your efforts are today's good news, as well as our network's hope for tomorrow. Looking forward, your board expects healthcare to become even more challenging, if that's possible to imagine. Our costs are rising faster than people's ability to pay them. The outlook for our economy is uncertain at best. Nationally, Americans are already cutting back on healthcare spending. Despite an aging and growing population, the number of physician office visits has been declining since the end of 2006, and we used to think healthcare is recession-proof. As people defer proper medical care to save money, just imagine the impact that will have on the acuity of our patients' illnesses in the future. Of course, the quality of our outcomes and patient safety record are increasingly under a microscope. Full transparency is quickly becoming the norm, and the list of companies anxious to rate our performance continues to explode. At the same time, we're dealing with an increasing shortage of physicians, nurses, and other clinicians. And don't forget the icing on the cupcake. Our government and other payers want to pay us less. Now, before we all get too depressed, allow me to remind you that by working together, our governance boards, our physician partners, our senior leadership team, and each and every one of you on the Community Health Network team have an opportunity to improve healthcare. We can reach higher, and we will reach higher. If you question our collective ability, just look around and reflect on where community hospitals started and where the Community Health Network is now. So here's today's first take-home message from your board. The real difference in healthcare today isn't the bright, shiny objects or even the latest technology. The real difference, the real strategic advantage, the real heart of the Community Health Network is people. The real difference is you. You and everyone like you brought us to where we are today, and you will take this network to where we need to be tomorrow. Now that we're all embracing change, I thought you might like to hear about some things that your board believes should not change. Here's one thing that won't change. As we seek our next network CEO, the board is determined to preserve and build on the culture developed by the current senior leadership team. We want evolution, not revolution. Here's another thing that won't change. The Community Health Network is the most physician-friendly network around. Physician relationships will continue to be a key to our future success. And here's one more thing that should be of interest to you. We will continue to value the contribution each and every employee makes to the network. So we will continue to hire, grow, and retain the very best people we can find. Moving on, I'd like to share the board's thoughts on quality outcomes and patient safety. We believe the Community Health Network has the ability and the talent necessary to measure itself against global best clinical practice, not just local best practice. Now, as a network, we do not fully understand the gap between global best practice and where we are today. So our first order of business should be to assess that gap, and that assessment won't happen overnight. And it will be a moving target as other institutions accelerate their own quality and safety efforts. The network can and should be proud of most aspects of our quality and patient safety performance to date. We are at global best practice levels with indicators like vent-acquired pneumonia. However, our HCAP scores don't look so hot, so we have room for improvement. Today's second take-home message is this. The future success of the network depends on our ability to successfully compete and differentiate our network on quality outcomes. We will not achieve our objectives without the full and collaborative partnership of the network board, physician leadership, administrative leadership, and our employees. You can expect your board to seek and fund initiatives that enhance the network's ability to compete on quality. Now let's turn to the board's position on mergers and collaborations with competitors. This is where life really gets interesting. Without burdening you with the tedious details, you should know that recently 2 of our competitors approached us regarding a potential merger of our network into theirs. After several discussions, the network board found little, if any, evidence that such a merger would benefit the small c community as a whole. So twice in the past year, we have informed a competing network that we have no interest in merging with them. In a rapidly consolidating market, the board remains confident that our network has the talent, the vision, and the skill to thrive in these turbulent times. We will continue to partner with physicians, clinicians, and employees to gain market share in the future, as we have in the past. And we will continue to grow externally by finding opportunities for other healthcare providers to affiliate with the Community Health Network, where such an affiliation or collaboration makes sense for both parties and clearly benefits the mission of both parties. So there you have it. We face tremendous challenges in our industry today, yet challenging times are also filled with opportunity. Our network is blessed with a culture that puts people first. That culture will be the springboard for our collective success. Looking at all that we have accomplished together and anticipating all that we will accomplish in the future, your board is very proud to be associated with the Community Health Network. Thank you for listening, and more importantly, thank you for caring.